Welcome, everyone. It's good to see almost 126 people who are already here, and hoping to see a few more join us. I also wanted to take this opportunity to thank many of you for taking part in the MIRA-iGeN study, and your participation is what makes this type of research possible. And we encourage you to stay connected with our study, any other research projects that we do here at McMaster in relation to aging. I'm going to start the conversation, introduce to you what MIRA-iGeN is about. And as Megan mentioned, that I will try to address some of the questions that you have sent beforehand as I go through my presentation. And before I begin, I just wanted to introduce myself. I am Parminder Raina. I am a professor here at McMaster University. I study aging, and I'm also the scientific director of McMaster Institute for Research on Aging. And you will hear a lot more about that throughout the afternoon. What we are talking about here today is a MIRA-iGeN, which is called the Intergenerational Study. This is a special initiative of the McMaster Institute for Research on Aging. And we wanted to develop something that becomes a platform for multiple research projects as we develop this further. Next slide, please. This is our team. Andrea is the lead of the MIRA-iGeN, and you'll hear from Dr. Andrea Gonzalez later on. I am the co-lead with Andrea, and Dr. Divya Joshi is a research associate on this project and actually leads some of the day-to-day scientific aspects of the study. And then you already heard from Megan. Megan is the backbone of the study from day-to-day point of view. And then we have several other members of the team who support the project in multiple fashion. I won't go through everyone, but they're all very important part of the team. Some of the individuals at the bottom of the slide are the people you usually hear from. So they are the trusted voice of the MIRA-iGeN project that you interact with whenever somebody makes a phone call to you. I also wanted to comment that there were several questions in the pre-question handouts that we got from you that were of very clinical nature. We are not a clinical study, so we probably won't address those questions, because in order to provide any clinical answer, you really have to see your physician who can help address those questions in the context of the clinical history. We look at data from a research point of view, but if there are any generic comments and questions, we'll address it, but we will probably not engage in any clinical advice on a webinar. So just wanted to be clear on that one. Next slide, please. And as part of our MIRA-iGeN team, just to give you a picture that this is an interdisciplinary team, it is an interdisciplinary project. So we have many investigators from McMaster and some of them from also University of Waterloo, who actually provide expertise to this project from multiple perspectives, from a policy point of view, from a biological aspects of understanding aging, to what happens in our communities and our society. So it is developing as a interdisciplinary project that will address many interdisciplinary questions as we move forward with this program of research. Next slide, please. So for today's agenda, I will give you some background and context about the MIRA-iGeN platform, who is participating, and Divya will come in and provide some initial findings. And then Andrea will talk about what the next steps are in relation to this project and what is our overall vision as to what we are doing. And we would like your input into what we are planning to do. And I also wanted to make sure that we are also changing the way we do research. We want to make sure that we stay engaged with you, because you're contributing your time, your valuable information to our research projects, including MIRA-iGeN. And we want to find a ways to stay connected with you and inform you and keep you up to date what's coming out of this research and how you are benefiting the society and your own families and your own extended networks in relation to the data that might be generated and the scientific evidence that might be generated through this project. Next slide, please. So McMaster Institute for Research on Aging is a university-wide institute, and the MIRA supports research initiatives that are aimed at understanding all sorts of different aspects of aging issues. And our goal is not to just extend life. Our goal is to how to increase good life in the whatever years we might have in front of us. So it is about healthy aging, living well, and through that, living long. And MIRA funds many projects, and many of you might be involved in different projects that are supported by MIRA. But today we are talking about MIRA-iGeN. This was fully funded through the institute internally to establish this project, and goal is to once we have established the initial platform, which you will hear from us today, and then we'll be applying for funding to government agencies like the funding agencies that we have in Canada to continue with this project. Next slide, please. So what are the overall goals of MIRA-iGeN? It is, first of all, it is to create a cohort of individuals who have at least 3 generations, as well as a cohort of individuals without any of those 3 generations. That, in other words, what we are trying to see, we need people in this study who are from the same family, have their children and grandchildren, but we are also interested in people who might not have children or who might not have grandchildren to participate in this study. We will be contacting people regularly over the next at least 10 years, if not longer. And the idea here is to investigate the interconnections among factors that influence health across the life course and generations. And I'll spend a little bit more time later on why this is important to study. And ultimately, this MIRA-iGeN is not only to gather information and understand, and our vision, our goal was to also develop this platform to implement and evaluate programs and interventions that actually make a difference in the lives of the people. And you will hear something about that later on today from Dr. Gonzalez. Next slide, please. So why is it important? First of all, this is the first time in our living history that we have up to 4 generations of the same family living at the same time. So it is an unprecedented period from a demographic point of view. And we are beginning to start thinking about how these different generations impact each other, what impact they have on the lives of their grandparents, and what impact grandparents have on the lives of their grandchildren. So it's a important feature for us to examine and understand and think about designing interventions that cut across different generations. Secondly, it's really important to think that in last Canadian census data, there's been a 30% increase in Ontario alone of multi-generational, intergenerational homes. So a lot of people are living together, and that also allows us to give an opportunity to understand what happens people who don't live in intergenerational homes versus people who live in intergenerational homes, how it impacts their health and well-being. And as I mentioned, we are particularly focused on healthy aging, and that we want to look at intergenerational factors, how they impact our health, mobility, a 6th vital sign of aging, mental well-being, and social participation. And social participation becomes really important because, as you might have heard in the newspapers, in the news, that loneliness is at an epidemic proportion. And it's, as I said, on one hand, that there's a 30% increase in multi-generational, intergenerational homes, but there is a parallel that a lot of people are also living alone in our communities and our societies, and what impact that has as we age is important to consider. Next slide, please. So this is just basically giving you the context within which we are studying. The number of older people are increasing everywhere, not only in Canada, even in low-income, middle-income countries. Actually, the rapidity of aging in those countries is much faster than it is in Canada. It is a global phenomenon. It is not a negative thing. It's absolutely an amazing achievement of the modern public health system that the people are living this long, and many are living in their homes and communities. And 10 to 15 or 20% have complex challenges, and we have to make sure that we support those individuals. But it is a remarkable achievement of modern public health system and social policies that has resulted in this demographic shift. Having said that, as people age, they bring a lot of assets and opportunities for our communities and societies, but they also raise some issues and challenges in providing services in a way that they reach each and every individual as they age. And we will have some conversation about that later on as well. Next slide, please. And Canada is no different. And this is what we call a demographic pyramid. And traditionally in Canada, there were a lot more individuals at the bottom and very few people at the top. And as you can see, this no longer looks like a pyramid. There's a lot more people in there over the age of 65, especially in the baby boom group and the 80 plus group. And there are less children below the age of 15 in comparison to the older people. In 2015, Canada, first time in Canada, there were more people over the age of 65 than the kids under the age of 15. So what that indicates is that there is a rapidity in which our society is aging, but it also highlights that we have many other generations that are also coming behind, and how we understand those generations and how that helps us understand the aging process is going to become very critical. Next slide, please. So I'll show you some examples specifically why intergenerational study is needed. Why don't we just study older people? That's important. We do that. And one of the study I lead is called the Canadian Longitudinal Study, which is a large national study, but that's focused on people over the age of 45. Here, we want to look at the interplay of different generations and how that impacts health and well-being. Next slide, please. Let's take an example of dementia, and I know it's very important to many people in our communities and in our population. And it clearly, this was a paper published in a very prestigious medical journal. And this was basically highlighting that dementia doesn't something happen at the later in life. Symptoms show up later in life, but some of the factors that impact dementia start to happen quite early in life, such as what happens to education. And there's a strong link between people's education and potential impact on cognitive impair. There are certain factors that happen in midlife: hearing loss, traumatic brain injury, hypertension, alcohol use, and obesity. And then there are certain factors that come into play later in life that increase the risk of dementia. And as you look at many of these factors as they're listed on this slide, they all can be modified through proper public health interventions and our own behavioral modifications. So our goal is to understand, do these factors, especially such as example as obesity, does that actually transmit from one generation to another to another? And if we were going to design and think about intervention, do we have to think about interventions that cut across generations, or we are focusing on a single generation? And the same issue applies how social networks and social inclusion happens. Is that something, a social phenomena that happens in families that gets transmitted across generations as people age? And that's one quick example of how intergenerational study like MIRA-iGeN gives us opportunity to understand the intergenerational influences of these factors on a condition such as dementia or cognitive impairment, which is really important for aging in a healthy fashion. Next slide, please. The other example would be, which I alluded to already, that this is a message from a US Surgeon General who basically pointed out that the loneliness and isolation is a major epidemic in our societies. In fact, in UK, they have a minister of loneliness whose goal is to focus on coming up with strategies to minimize loneliness in our population. The interesting phenomena is that loneliness happens predominance of the loneliness in two age groups. Younger people, first and second year university kids who come to universities, they feel extremely lonely, and then the older people. So here again, it gives us opportunity to develop intergenerational programs that not only focus on younger people or older people. Can we create intergenerational interventions to focus on issues related to loneliness and social isolation? For example, at McMaster, we recently announced that we are going to be developing an intergenerational hub. It is a new student high-rise building is coming out, and we are actually going to build an intergenerational hub, and we want to figure out a way to interact younger and older people to support each other, interact with each other, learn and teach each other in different areas, and also provide opportunities for new research ideas to be developed through that process. Next slide, please. And why is loneliness important here? Loneliness is linked to heart problems, depression, higher stress. It results in brain changes. The dementia slide I showed you that had a social isolation as a risk factor, and we understand that it starts to make changes in the brain because body sees loneliness as a stress, and that stress starts to result in biological changes, physiological changes in our bodies that starts to have impact on our particular outcomes and body structures. There's a high alcohol and drug abuse risk and decreased memory. So it's an important phenomena that we really trying to understand from an intergenerational perspective and see how we can mobilize resources in our families, in our communities, to make sure that it benefits multiple groups of individuals. Next slide, please. So studies like the MIRA-iGeN can help us understand how intergenerational connections within and outside of the family influence our health, and how health problems can be addressed from an intergenerational perspective. And that's the main motivation behind this program that we are developing. And this couldn't be done unless people from individuals like yourself participate, encourage your children and grandchildren to participate in this study, to really start to understand how we make sure that the younger people age in healthy fashion. So when they get older, they have healthy, active, and productive lives, and also try to understand how do we support our older people who are already in their latter years, and how we can use intergenerational strategies to improve their aging in place to say. Next slide, please. So, and you'll hear a little bit more about it. This MIRA-iGeN is being set up as a program within which we will do all sorts of different studies. We might look at technology as a way to enhance healthy aging across generations. It might be that we want to conduct some clinical research projects or epidemiological research projects to understand why some people age in a healthy fashion and others don't, and what kind of factors influence bad outcome versus good outcome, so we can learn from those types of activities. Social aspect types of studies, how we understand social behaviors are transmitted. Biological, I already mentioned obesity and metabolic changes that happen. And there is some early evidence that these things do actually cut across generations. Some of it is genetic and some of it is behaviors. And again, as I mentioned, implementation of community interventions, and how do we start thinking about coming up with programs and interventions that can be targeted at community level to change behaviors and improve healthy aging. Some of you might be involved in some of the studies that are already being conducted within MIRA-iGeN. One of those is called MAC-M3, which is looking at mobility and technology specifically. And some of you were recruited through this study to take part in that study. And so it is a family of studies that we are trying to create and maximize our understanding of the aging process from an intergenerational perspective. Next slide, please. So what is the iGen design? What does it look like? In the middle, the blue part, we are recruiting individuals who are over the age of 45 right now. You will hear more about that, and many of you are already participating. We have asked permission to ask you to help us recruit your children and grandchildren. And as I mentioned, we are not just interested in individuals who have children and grandchildren. We are also interested in individuals who have no children or grandchildren, because understanding their trajectory also helps us understand what type of strategies and interventions that we might want to do. And in the core study at this point in time, and it will broaden as we go along with the funding we have at this point in time, we are looking at demographic factors. We are looking at factors that impact health. We are looking at how families function, how different intergenerational relationships happen, what kind of social aspects of aging are being, social health are being measured in this study, and what people are doing. Their caregiving. There are many people who we call a sandwich generation, where they are providing care to their parents and providing care to their children. What kind of impact that happens on the health of the caregiver? Physical and mental health and healthcare utilization, lifestyle and behavior. That includes physical activity, nutrition, and other behaviors such as smoking and alcohol consumption. And we are following these, all of you, right now, every 2 years, by using these questionnaires. We will implement studies in the future. We will collect more data, more in-depth data, with the consent of all of the participants. But at this point in time, this is the type of data we are collecting. Next slide. So what are we doing in this study right now? Our goal is to have an index population. That means you at this point in time, 3,000 of you to be recruited in the study. And then these 3,000 people, we are going to try to recruit their children and grandchildren. The goal is that at the end of the study, we will have 8,000 to 10,000 individuals across generations recruited into this study. The first form of recruitment we did was using random digit dialing. So we actually created a random list of phone numbers, and that's how you got contacted, and that's how you engaged in this study. And through you, we will be recruiting your children and grandchildren if you have them. And now we are also trying to do other methods of recruitment, because we also want to make sure that the people we recruit in the study, it represents different diverse communities. And we know from research that the many people from many different backgrounds don't respond to telephone calls or random surveys. So we really have to make effort to build trust, build relationships, and go in those communities and identify those individuals. And we are working with our experts who know how to collect, how to recruit people, and come up with a sample that actually represents the population that we are trying to represent in this study, which is the Hamilton to Toronto corridor that we are looking at in this study. Next slide, please. So at this point in time, we are going to share some preliminary data with you, what we have so far collected as part of our baseline collection. And Dr. Divya Joshi is going to give you a quick whet your appetite. These are just preliminary numbers, just to get you excited what is pulling out. We'll be doing more advanced analysis in the future, but this was just to show you what you have given us to date. Thank you.
Okay, so I will be sharing some preliminary findings from the questionnaire that you've completed. To date, we have 2,237 individuals that have completed that questionnaire. And we really are grateful for that high response rate, as having a large number of people participate in the study is going to help us obtain more accurate estimates. So among people who have completed the questionnaire, 2 in 3 individuals are 65 years of age or older, and the rest of them are younger than 65 years. Currently, we have slightly more females in the study than males. 1 in 4 individuals have indicated that they live alone in their household. And when we look at the race ethnicity distribution, majority of the individuals in the study currently are of European ethnic background. Nevertheless, the demographic distribution of individuals in our study is reflective of the Ontario and Canadian population. But as Dr. Raina mentioned, in the future, we would like to encourage people from more diverse groups to participate so that we can have a better understanding of factors that affect health and aging of all people across all generations. We also have a diverse representation of family types in the study, with some individuals reporting having up to 4 generations of family members. A majority of individuals, so around 80%, have reported having children, and this includes biological children as well as adopted and stepchildren. And at the same time, a substantial number, so around 20%, have reported not having children. Half of the individuals in the study have reported that they have grandchildren, and half of them do not have grandchildren. And 1 in 3 individuals have reported that they have living parents or grandparents. And so having individuals with different family types is helpful, because this is going to allow us to compare and to examine factors that affect health and aging among those who have intergenerational relationships and those who engage in intergenerational interactions compared to those who do not. And so again, as was already mentioned, people are living longer, and in the current economic and healthcare scenario, we find that many individuals are faced with the possibility of providing care to their family members. And so in the questionnaire, we collected information about whether you've provided care and the type of care or assistance you have provided to family members, to friends, and to other people living both inside and outside of your household. And we found that 1 in 5 individuals provided care to their grandparents, parents, children, and or their grandchildren. And so when we say provided care and assistance, this would include assistance with things like personal care, medical care, making medical appointments, helping with housework, grocery shopping, delivering meals, and things like that. 81% of individuals indicated that they have not provided intergenerational care, but I should clarify that they may have still provided, or some of them may have still provided care to other relatives, to siblings, to neighbors and friends, and so on. And so examining intergenerational caregiving is important because we know that it may have effect on our health as well as our economic outcomes. And although intergenerational relationships and interactions can affect all aspects of health, today we are sharing some preliminary findings related to mental well-being. And we've looked at 4 indicators of mental well-being, including depression, satisfaction with life, loneliness, and stress levels. And what we found is that 1 in 5 individuals have reported high depressive symptoms, and 1 in 5 individuals also reported not being satisfied with their life. 2 in 5 individuals reported feeling lonely, and 2 in 5 individuals also indicated that they have high stress levels. I should note, though, that the questionnaire that you completed was during the COVID pandemic. And so factors and circumstances related to the pandemic may have influenced some of these numbers, but these rates are still similar to what has been reported by other large population studies. And as you know, because we will also be following up with all of you every 2 years, we should be able to see any changes in these mental health indicators over time. So we examine mental health indicators among individuals who have children, and these are indicated by the green solid bars, the darker green solid bars, and those who do not have children, and these are represented by the lighter lined bars. And so the preliminary trends that we see is that while many people are experiencing mental health concerns, individuals who do not have children are reporting poorer mental health than those who have children. And again, if we look at loneliness and not being satisfied with life, there is 10 to 12% higher loneliness and dissatisfaction with life. And anxiety is twice as high in those who do not have children compared to those who do. And again, depressive symptoms and stress levels are slightly higher for those who don't have children compared to those who do. But we do want to be careful here and not overinterpret these results without considering other factors that may influence these trends. And so we still need to understand why people are experiencing poor mental health and what can be done about it, especially from an intergenerational perspective to support these individuals. So these graphs here show the same information as the previous one, but here I've also considered marital or partner status. So the set of graphs on your left are for those who have a partner, and those on the right are for those who do not have a partner. And what we see here is that individuals who do not have children report poor mental health, but even among this group, mental health is better in those who are married or have a partner compared to those who do not have a partner. And again, these are very early findings. The relationship between these factors need to still be examined in greater detail for us to understand why people are experiencing mental health issues and what interventions and policy changes can be implemented to address these concerns. Here we've examined mental health by caregiving status. So this is what does mental health look like for those who are caring for parents, grandparents, children, and grandchildren. And we have looked at 3 indicators here, depression, anxiety, and stress levels. And so for each of the indicator, the first bar is indicating those who have provided no intergenerational care. So they've not provided any care to parents, children, or grandchildren. The second bar is for those who have provided care only for children or grandchildren. The third bar is for those who have provided care for parents or grandparents. And then the last dark green bar is for those who have provided care for parents, children, and grandchildren. So providing care for 2 generations. And it is this group that we see that is reporting greater depressive symptoms and stress. And anxiety seems to be slightly higher among individuals who are providing care to grandparents and parents compared to other groups. In the questionnaire, we also gathered information on the use of healthcare services and the types of services that you would like to have access to. And so here are some of the more frequent responses that we have received. Just under 1 in 3 individuals who completed the questionnaire indicated that they would like to have more opportunities for engaging in physical activities. So things like more yoga classes, drop-in programs. around 1 in 5 individuals indicated that they would like to have more support groups for caregiving of adults, and more services related to education about existing services in the community. Around 12 to 15% have expressed interest in services that offer individual counseling, assistance with using technology, assistance with accessing services such as accessing benefits counseling or case management and things like that. About 12% indicated that they would like to have services related to education about personal health issues, such as managing chronic diseases like diabetes and hypertension and so on. And just under 10% indicated that they would like home care services. And so these findings are important because they will help us determine what factors contribute to healthcare needs that are not currently being met in the community, and what impact that may have on health of individuals, and eventually help us develop ways to improve access to these services. So we also asked individuals to provide reasons for why they're currently not using these services. What are some of the barriers that they have experienced in accessing these services? And the top 3 responses that we received are that individuals did not know that the service was available, or where they can go to get that service, or that the service was too expensive. And so these findings are suggesting that there is a clear need to not only develop services, but also to raise awareness about available services and programs, and to remove barriers and to make it easier for people to access them, and for policymakers to find ways to make services more affordable. And so now will hand it over to Dr. Gonzalez, who will share with you the future vision of the MIRA-iGeN.
Thank you so much. Welcome, everyone. I'm thrilled that we're having our first MIRA-iGeN event and that 150 of you have joined virtually, and we are recording this for other members. I am an associate professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster. iGeN is sort of close to my heart because I feel that I'm a living example of it. I have a multi-generational household with my mom who lives with us and a 14-year-old son. And also provide support and care for various family members that don't have children. So, I'm going to take a step back. Parminder provided an overview of why an intergenerational cohort like iGeN is really important to understand trajectories of health and well-being, both within and outside of families. And Divya gave you a short, exciting summary of preliminary information that we've collected from you to date, including those last few slides about what types of services and programs that you'd like to see. And really collectively, this will help us with our next steps in terms of planning what kinds of programs and interventions are needed for you and your family, for your social networks, as well as informing policy and advocacy for the future. So it's really important to remember that we're trying to build iGeN as a platform, really a platform where we can go on to think about what kinds of future visions are sort of possible. So this is a somewhat complicated figure, but I think it's a useful model. Next slide. In terms of our framework to help guide us in our intervention and program planning and thinking. It's a model that's widely used around the world and endorsed by the World Health Organization for a multi-pronged strategy that's aimed at preventing and managing the increasing incidence of chronic conditions across the life course. And as you can see in the figure, it includes components of the microsystem, which is like the individual and the family, as well as the mesosystem, which is healthcare, but also going beyond healthcare, because healthcare isn't just part of the healthcare system, it's also part of our community and the services that we receive in the community. And then above all of that is, the policies that are being formed by our various levels of government. And this framework doesn't prescribe specific changes, in terms of what needs to be done, but really it gives just a model in which we can tailor specific interventions and programs to meet the unique needs of communities and individuals. So it's certainly one that kind of helps frame our own thinking and our work as we move forward. Next slide, please. We wanted to provide one existing example that sort of fits within this framework. And this really also came about based on some of the questions that we received prior to the webinar today in terms of where can people go for information that they know is evidence-based and reliable and trustworthy. So one of those kind of sources is the McMaster Optimal Aging Portal, which is really based on the evidence and very current evidence because it's updated quite regularly. And it helps, provide information for decision supports and information on various topics. Next slide, please. So this would be if you logged into McMasterOptimalAging.org. This would be the kind of website face page that you would see. And as you can see, they have information on a whole bunch of topics, and it's really easy to search for any kind of topic of interest. And you can sign up for newsletters to receive from the McMaster team that runs this. So that's just one example of where you can go for information moving forward. Next slide, please. I also wanted to provide another example, again, working within this framework or system. It's a relatively new study that's being funded by the McMaster Institute for Research in Aging called Embolden. And there are many components to it, but it's about enhancing physical activity and reducing social isolation and loneliness. And they're using a co-design approach within the communities and seeking individuals' input into the type of programs that they would really be interested in. And I think this is a study that's specifically for older individuals, but I think it serves as a really nice model and example of the kind of study that we could be looking but applying more from an intergenerational and life course lens for many, many individuals. Next slide. So this is just to highlight, can we build on some of these existing initiatives, whether they're at McMaster or around the world. We're going to be conducting a literature review, kind of looking at what intergenerational programs actually exist. But really, again, taking an intergenerational or whole life perspective to develop, implement, and evaluate new initiatives. And these could be targeting loneliness or physical activity or building social networks. Our direction and our vision is really being informed by the information that you are providing us in the surveys and information that we will be hopefully getting from your family members as well. Next slide, please. And really, when we think about programs or interventions and how to develop them, we have to take a whole view of the self. So we know there are so many things that affect our health and well-being. So things like our housing situation, education, food security, what services we have access to, both in terms of healthcare or social services, our families and our social networks, and our work. And there are many, many, many different things that all sort of factor into our health and well-being trajectories. And some of these things are the kinds of questions that we tap into on our surveys, and again, will help inform the next steps that we take. Next slide, please. So because there are so many different things that affect our lives and you know, our families, you know, there are many ministries in Ontario that oversee all of these things. You know, Ontario has 29 different ministries that are relevant to individuals and families across the life course. And I've only listed a few of them here. You know, but one of the problems that we've seen in various studies in our research is that these are extremely siloed. So health oversees health, and then there's education and community and social services, and there's very rarely any kind of intertalk or you know, overlap between them, and so it makes it really, really complicated. Next slide, please. When we're trying to navigate these systems. So what happens when, you know, we have these multiple individual services, whether it's social services or housing or financial or education or health services, they're all done by different ministries, they're all done by different organizations and different providers. It makes it extremely challenging to navigate, which is consistent messaging across many of our studies. In terms of identified barriers. There are facilitators in the system, which we, you know, are happy to kind of highlight, but there are many barriers as well. So really, if we had to take a big step back and think, well, what's our ultimate vision, you know, with MIRA-iGeN, it's really, yeah, pie in the sky goal would be to move from these siloed systems to intergenerational ecosystems. So what do I mean by that? It means, you know, can we advocate for and implement and develop more integrated systems for individuals and families that exist across the life course and across generations, where we focus on health and prevention. So things like physical activity. It was one of the highest rated needs for services on our survey thus far. And also addressing the social determinants of health, those things that we know sort of affect our health, like our housing security and education and financial situations as well. Next slide, please. And this vision is very much aligned with the World Health Organization's vision of age-friendly communities, where they've really advocated for countries to take up national programs for different kinds of age-friendly cities and communities, and they've developed a guide for it. Next slide, please. And there are many, many of these cities. There are thousands of them now across 51 countries. You know, it's wonderful to say that Canada has 900 of these age-friendly communities. 69 of them are identified in Ontario, many of which have seniors active living centers and different kinds of programs and organizations that sort of promote healthy aging kind of within the community as well. We would like to expand this vision to include all ages and generations, and not just, you know, focusing on the older generation as well. Next slide, please. So again, in terms of moving from siloed systems to intergenerational ecosystems, I personally would like to advocate for what I would call a horizontal integration of services across community sectors, so we don't have those navigational challenges that many of us face, as well as a vertical integration across levels of need, so that, you know, you have a community support system. If we develop age-friendly and intergenerational communities, we might have universal health campaigns, which we've seen in terms of vaccinations, have been universal. It's a successful example of a universal kind of health campaign across different generations. Media and technological innovations. There's lots out there in terms of using intergenerational relationships to promote technology use, and even if your family is far away, to have support systems to help you keep in touch with your family members. Having system navigators if you're having difficulty navigating the system yourself, as well as these community intergenerational hubs or potentially mobile units if you aren't actually able to get to where you need to go within the community. So this is, again, a very big model. This is not that we're saying that we're doing this within iGen. We're really looking for feedback and looking at all the data and information that you give us that will help us inform these next steps according to really all your stories and your family's stories as well. Next slide. So we need you. It is really, our vision is really your vision. So we need you to tell us what your vision is for you, for your family, for your future, for your social networks. What programs and services should we be developing and thinking about, and what policies really should we be advocating for? And really, this is all going to come down to you and you participating and telling us what you need. So next slide, please. So in terms of concrete next steps, so now I went from like the high level, and I'm going to go back down to sort of the nitty-gritty details. We're now at the point where we're attempting to recruit, if you've provided us information about your family members and your children, to recruit that next generation, so to recruit your children. So we've either mailed or emailed a package to you that contains the study information. We really would appreciate if you could share this information with your adult child that we have selected randomly to participate. And if your child agrees, then they will complete a short 5-minute questionnaire to see if they qualify for participating in the study. So that's sort of part one of the next steps of the work, is to be recruiting other members of your family and your children as well. And if you have any questions about that, you can either put it in the Q&A session right now, and we're happy to address it, or you can contact members of our team after this webinar. The second next step is that we will be following up, as was mentioned earlier in the webinar, every 2 years. So we're going to be following up in the fall, and we're going to be reaching out to you to complete another survey, so that again we can look at trajectories of change and what kinds of things factor into those changes that are happening in terms of your health and well-being. Next slide, please. In addition, we're really hoping now that the weather's better, and fingers crossed that we really are moving beyond the pandemic, that we can offer in-person events planned in various locations throughout the Greater Toronto Hamilton area for those of you that would like to come and bring your family members to come to these in-person events. We also want to start maintaining more consistent contact with you, so we're going to be providing newsletters with study updates. And again, the webinar recording will be made available on our website. We did, however, want to mention, because there is contact from our team regularly, and we also know that fraud is on the rise, and it's sometimes difficult to differentiate between what's a real ask and what is what's fraudulent. I myself got caught in this kind of thing when my computer froze a couple of weeks ago. We really want you to pay attention to, if something is coming about the study, it's coming from one of our team members. So it's coming from Megan or Sharon, or one of those research assistants that you saw on the first slide, coming from a McMaster.ca email address. So we just wanted to make you aware of the potential for fraud, and that anything coming from us will come from one of our team members. Next slide, please. So in terms of where some of our information will be posted, such as the recording of today's webinar or our newsletters, which we'll also be sending either via email or hard copies in the mail, you can always reach us at mira.mcmaster.ca and look just for the intergenerational kind of bar there and information. Next slide, please. So really, again, thank you for your time and your participation. We've left lots of time here at the end because we would love to hear from you. We want to answer any questions you might have or any concerns you might have, but really, really, really appreciate you showing up today. So thank you.
So there were lots of questions in the question answer. Many of them I tried to answer as I was going along, but there are a few additional questions. Perhaps Divya or Megan, there are some questions related to the recruitment of children, and people either didn't know about it or have not received information. I was just going to say here, some of you said no to connecting with your children in case you are planning to change your mind. And please feel free to contact us because we would like to recruit as many of your children into the study to increase the power, statistical power of the study to make very definitive conclusions from our findings. So please feel free to contact Megan or Divya or myself or Andrea if you are interested in any additional information from us. And some of you who did not receive a package, we will be in touch with you to make sure you have, we have sent you the package. If we haven't, we'll send you one. And if you have received and lost it, we'll send you another one. And so the goal is to recruit as many individuals we can. Divya, Divya and Megan, there was a question and I couldn't remember. That's why I didn't answer. What is our definition of caregiving so if you look at the question from Deanna Grutzinger, and she's in the question answer, the question is, what is the definition of care? Does it require a certain amount of time, is ongoing, or would it include things such as occasional babysitting? And she's right, those are two very different types of caregiving. So do you want to comment on that, what our questions are?
Yeah, so for the purpose of this presentation, caregiving was dichotomized as a yes/no, whether you provided care or did not provide care. And we do collect information on the hours per week that you've provided care, but that wasn't factored in for this webinar.
So in other words, the answer is that we do have time, demand, collections, and what type of care they're providing in relation to providing to someone who is sick, ill. You're providing continuous care for how long, do you have any respite from that care, and so on and so forth. So there's a whole module on caregiving that we capture. There was a question earlier on in the chat side that I had made a comment that the aging is a remarkable achievement of the public health system. And I think there might be a misunderstanding. When I say public health system, I'm talking about public health. And if you look at the data from over 100 years, much of the increase in life expectancy has happened because of sanitation, improved environment, better diet, and discovery of penicillin. And then after that, there has been an incremental increase through the healthcare system. So when I'm talking about public health system, I'm not talking about healthcare delivery. I'm talking about public health, which is all about prevention. I didn't see the front part, but the question was, does this change? Did this change since COVID?
So the data that I presented, we understand that was collected during the pandemic. And so pandemic stressors may have played in the role in how high some of the mental health indicators were. The fact that we are collecting data every 2 years, we should be able to see if those trends remain stable or if there is an improvement in mental health, and whether any sort of interventions that take place between now and then, if those interventions are effective in improving those trends.
And we will look at population estimates of these numbers based on other data we have from other studies that collected data from pre-pandemic, during pandemic, and post-pandemic, and we'll compare our data with that to see whether these are changing as a result of pandemic being over. And that's where the longitudinal data collection becomes important for us to understand how these changes are happening. I'm not sure I'm keeping track of all the questions in the question answer. Are there some questions I haven't? For example, there was a question, long-term care home for seniors are in crisis in the province. They're in crisis all across the country. As a matter of fact, right now we are not recruiting people from nursing homes or long-term care homes, but we will follow people as they move into the long-term care sector, especially the seniors, and there will be opportunity, which we are not doing. And this is what we meant earlier on, that we have opportunity to develop targeted studies in this platform, where we can ask about people's preferences as to what the long-term care sector should look like. And that the study like this platform like this provides that as opportunity to understand from younger to older to people what they will like the long-term care sector to look like. Because right now in the province, we are just tinkering around the existing long-term care and not really addressing the real issues. What is the best possible way to provide long-term care, and what do people really want?
Parminder, I wonder if you could speak to, I know early on in the study, there were people that expressed an interest in understanding how relationships with pets impact our well-being. And that's a question that's come up a few times here in the Q&A. I wonder if you could speak to that.
Sure. I can talk about it because actually part of my PhD work many years ago was on looking at what impact having pets is on the health and well-being of the older people. And we did show in our research, that was also a longitudinal study, that having a dog or a cat has beneficial impact. Other studies have shown improvement in blood pressure because we talked about loneliness earlier on, and when people are living alone and they have pets, they have to go out to buy food for the pet. When they go buy food for the pet, they buy food for themselves. They have an opportunity to interact. So it provides this indirect measurement, indirect means to increase engagement, have food and right groceries to cook healthy meals, and so on and so forth. So there is some benefit. Is it enough alone to impact the whole longevity and healthy aging? Probably not. It's just one additional social mechanism that we have that pets can provide to older people and younger individuals. In fact, it is in a way a good way to have intergenerational relationships, because if you ever took a dog for a walk in the park, you end up interacting with many people, and it provides opportunity for intergenerational social connections.
There are some questions coming through, and I've handled some emails over the last few weeks around, I think there is some confusion around, there are a few different studies running at MIRA, and I think some people are confusing MIRA-iGeN with MACM3. Parminder or Divya or Andrea, if one of you could speak to the different studies that are running currently, and maybe particularly MACM3, because there are a few questions about watches coming through here to do with the mobility study.
Maybe I can take it. Yes, there are multiple studies. They are all focused on looking at different aspects of aging. And I know many of you are involved in our multiple studies. And for example, if some of you are involved in in the MACM3 study that is specifically focused on understanding how changes in mobility, physical mobility, or transportation and others, changes in the community mobility impacts health and well-being. So some of the people from MIRA-iGeN are part of the MACM3, and we will be able to look. So in MIRA-iGeN, we won't collect a whole lot of data on mobility because MACM3 is doing, but we will bring all these studies together at the end to create more comprehensive data to look at comprehensively different aspects of the aging process. So it's okay to participate in multiple studies because they're all contributing to such a complex process of aging, because aging is not just a clinical or a biological issue. It's a psychological issue. It's a social issue. It's an economic issue. So we are trying to capture multi dimensions of aging process from an intergenerational perspective that these studies are doing. Just to clarify, MACM3 at this point is only a study of people over the age of 65. It's not an intergenerational study. It only focuses on seniors, but we, as iGen, is focused on intergenerational issues. And there was a comment on older people having relationships with pets. Yes, they do. And we have looked at measuring pet attachment and how people feel their relationship and emotional contact with their pets as well. Is there something I missed, Megan, in the questions or others?
No, we do have a lot of questions coming through around finances and how if we'll be measuring how finances impact overall well-being as we age.
Yeah, I think I answered some questions earlier on. We capture data on household income.
Okay.
Some of the issues related to spender versus savers. These are tricky questions to ask in a survey. A lot of people don't provide answers. If we are going to do that, we will be doing some targeted modules in our data collection. There's so much we can ask. We always trying to balance how many questions we ask, how much data we collect from you, and how much time burden we are going to be putting on, because the strength of study of this nature is your participation. As many of you participate, actually increase the robustness, scientific robustness of the study. So it's always a bit of a balancing act on our part. But we have decided that we right now creating a core study, and then we will be going and asking you to provide specific data on specific topics, so it will not take as much of your time to complete those questionnaires. Because there was a comment or question about climate change and anxiety around climate change. We actually originally had a very long module on that, and because the questionnaires were getting so long that we only put a part of it, and in the future, based on that, we will be collecting questions, especially intergenerational anxiety around climate change becomes really, really important from a mental health point of view.
And I'll just add that in addition to what Parminder was saying, we are hoping to have more of these webinars. So if we're noticing that, financial concerns or planning for pensions, I think was a comment that came in prior to the webinar, are important to our participants and to all of you, then we can start to think about maybe having a webinar specifically about financial planning, for all generations and for all individuals, and, with issues like inflation and the interest rate and things like that as well. So it is important for us to hear from you, because it might inform the next steps for the questionnaires, but also topics that we could potentially address in future webinars and information sessions.
And part of the engagement with you and the people who are participating in the study is not only to keep you informed what's going on, and it's also to get ideas, what is important to you, as Andrea said, that we can actually start formulating data collection tools around those topics. So it's we are hoping this would be a two-way street, that we provide you information and you ask us questions, which gives us ideas of the most relevant things that we want to collect that really matter to people. And so we really appreciate your engagement with us today and providing really asking wonderful questions, and even in advance and during the presentation. And hopefully we have addressed many of those. Divya, there was a comment that one of the participant, Remus Donatus, I hope I'm not brutalizing your last name. Person has a son who might be interested in participating as well. So we can connect with some of you directly.
Yeah. So Remus, we would have randomly selected your child. Ideally, we would prefer that selected child completes the questionnaire. If they are unable to complete the questionnaire, we would select another random child. And after 2 random selection, if we are unable to recruit your children, in that case, we would then recruit the child that you've identified who is most likely to participate. So just to ensure that the sample we have is a random sample of participants and that it's not influenced by, selecting the most favorite child or always selecting the oldest child, we go with 2 attempts to select a random child. And if we are not successful, we then make a 3rd attempt where we ask you to select the child that you think is most likely to participate.
The question was, what if there's only one child? In that situation, we will recruit that child because that's the only one you would have given us in the list of children you have.
I think just to clarify as well, sorry, Divya, if you said this already, but if you only have one child and interested in participating, or none of your children are interested in participating, we would still
be interested.
Would like you to continue to be involved with the study. It doesn't mean that you can't still participate.
No, there's another question that just came in about having 4 grandchildren, all in their 20s, but only 2 living in the general Toronto area.
Yep.
And does geographic location matter?
No, geographic location doesn't matter. They can be anywhere.
Yeah.
There any more questions? We've covered a lot today.
There was one question from Ben Stadelman. Is gauging attitudes towards MAID an appropriate topic for this study? Yes, it would be something we can consider. We are collecting data on a national study on that issue, end-of-life issues, and what decisions people make. But this is something we could consider because it's an important social issue and specifically relevant to not only to older populations, but even younger populations who are experiencing some challenging health conditions.
There was a question further up, I'm not sure if it was answered yet, about will Ontario ministries listen to and act upon information that is collected? I thought you could talk about your policy connections, Parminder.
Yes, we try. It's always difficult to know what the governments will implement. I think the important part is that we have developed ongoing relationships with policymakers in different ministries at the federal and the provincial level, and these our goal is to provide them with data and evidence, so based on that they can make informed decisions. I can give you an example. In Ontario many years ago now, we always worry about caregiving for persons with dementia. So a lot of government was focusing on how we are going to support the caregivers who are providing care to people with dementia. And then here my colleagues at McMaster who are doing work with children with cerebral palsy and other developmental disabilities, and families are providing tremendous amount of care to those children as well, and they don't have services. So we had done some research where we have brought these 2 things to show that if we create caregiving services, caregiving support or caregiving respite, it not only benefits the caregivers of the older people, it also has benefits for the parents and the caregivers of the children who are experiencing developmental disabilities. And up for many years, that program was available as a across the life course. And I'm not sure anymore where that is. I think it has changed. And so we provide information to policymakers, but policies are political decisions. Sometimes evidence gets heard and sometimes it doesn't. But goal is to keep them informed.
And I'll just add that one of the nice things about our collaboration is that Parminder and I work at different ends of the aging spectrum. So we represent different ministries and different age groups as well. So it's a great collaboration.
And I think it's not only the policymakers, we are also engaging with private sector. For example, the way the malls are designed. In wintertime, a lot of older people end up going to malls. Some of them have very few benches, very few places for restrooms, and it's very challenging for people to find, and especially people who have some mobility limitations. And we work with these groups as well to see how they can make these public spaces age-friendly. And Andrea talked about age-friendly communities. And the thing about age-friendly communities is that once you make a community age-friendly, it's friendly for all ages. And prime example of that is Burlington Mall. If you go to Burlington Mall during the week and all the changes that mall has done, all you see is younger families with children and older people hanging around because the physical environment has changed in a way that it supports both spectrums of the life. So I think we need to do more in that sense than just focusing on policymakers. There's a lot our business partners can do of making aisles in grocery stores not too tall, or making them wider so a stroller or a wheelchair or a walker can walk through, depending on what the situation might be. So I think there's a great amount of opportunity in our communities to influence and make changes. There was a question about intellectual capabilities. Yes, when we start to look at the aging brain part of the MIRA-iGeN, and that's the exact part we will have to think through, is that how do we measure people's cognition? And in younger people, there might be some of the cognitive measures that we will use are going to be related to their intellectual ability and how that transcends across different ages. And all the there is another area which we haven't tackled, which needs to be tackled, because children with intellectual disabilities never used to live that long. Now they are living long and they're aging into old age. So we have to understand their aging process, which is probably going to be very different than somebody who is doesn't have those disabilities. And whether that happens within MIRA-iGeN or it is going to be a different research program that we will have to develop. But these are the real issues, because as these people get older and many of them end up in long-term care, it is very hard for people to differentiate whether their challenges and behavioral issues are a function of a intellectual developmental disability, or is it actually a dementia? We know very little about it. And I think there's a lot of work to be done in this space. Yes, I think that's a great idea. There was Andrea's typing an answer. We have also on MIRA website, many of you can go and sign up. We have created a voice platform where we can engage with you, have a dialogue, and you can engage with each other and see what topics the research might be, should be looking at. And maybe, Megan, you can share that voice link to people, and if they can register, and that could be an opportunity for you to engage in more meaningful way than just one-time webinar, more regularly in our programs and projects, and generate ideas with you. And that's exactly what we want to do, is to generate ideas that are relevant to people's lives rather than us thinking in silos. I think that I just wanted to say thank you to Remus for making that comment. And there are some comments coming up that it will be great to create a small working groups, small groups where people not only provide input into us, but they can have a social contact with each other as well. So we can create that platform on our voice platform and send it. It seems like many people have access to internet who are here. And we will be happy to engage you in that process.
Just really appreciate everyone's participation to date, including coming today and all your thoughtful questions. And it's really energized me, and I'm really excited about the next steps, and hopefully we'll see you again.
Yes, and if you know other people who are interested in study of this nature, please send them our way and we'll see if they are eligible to be part of the study, especially if you know people from diverse communities, because those are very hard to recruit. And we need to make a collective effort to make our sample very diverse. Thank you. I really appreciate your time and your interest.